Welcome to this month's Science Action Network webinar. My name is Swathi Rayasam, she, her pronouns. I'm a science associate at UCSF's program on reproductive health and the environment. On the next slide. If you could, folks, just throw yourselves on mute. You're welcome to keep yourselves on and off camera as kind of suits you or as meets your access needs. And if you have questions and comments, if you don't mind typing them into the chat, and we'll keep an eye on that during the presentation. We just want to make sure to give our presenters, all the time that they need to kind of flow through their presentation. And there will be a Q&A that follows the presentation. So then on the next slide. So we've got a pretty great agenda today. We have Dr. Kim Terrell and Gianna St. Julien from the Louisiana Environmental Law Clinic, the Tulane University Environmental Law Clinic. They'll be doing a presentation titled Revisiting Cancer Alley, Drivers and Outcomes of Pollution Disparities in Louisiana. Then I'll be giving some quick updates about EPA and OMB, as well as some updates around TSCA with Dr. Jessica Trowbridge, who's on the call today. And then Courtney Cooper will be giving some systematic review updates before we wrap you up and send you off for the day. And then on the next slide. So I am really, really excited to introduce Kim and Gianna. So Dr. Kimberly Terrell is a research scientist and the director of community engagement at the Tulane Environmental Law Clinic. She has broad expertise related to environmental issues, including public health, statistics, and air monitoring. And her current work focuses on the intersection of science and environmental regulation, particularly with respect to underserved communities. Dr. Terrell also works to promote science literacy among environmental decision makers in Louisiana, particularly with respect to the precautionary principle and challenges of identifying adverse health outcomes in small populations. She's also provided expert testimony on environmental issues and was actually providing expert testimony yesterday, which is why the webinar was rescheduled for today. And then Gianna St. Julien joined the Tulane Environmental Law Clinic in 2020 after receiving a bachelor's in environmental science with a concentration in soil and water quality and geology from the University of Louisiana at Lafayette. As a native New Orleanian, her work with the Environmental Law Clinic is centered around community engagement in Louisiana by providing environmental health resources and information to community members and assisting local environmental justice organizations in the tracking and permitting of new and existing industrial projects throughout the state. So I will pass it over to our presenters. And again, folks, if you could mute your audio and type your questions into the chat, I would be very appreciative.
Hi, everyone. Thanks, Swathi, for that introduction. As she said, my name is Gianna St. Julien. I'm a researcher and the community engagement specialist at Tulane Environmental Law Clinic in New Orleans. And I'm joined by my colleague, Dr. Kim Terrell, who is a staff scientist and director of community engagement at the clinic. And today we're going to be co-presenting to share the results of two of our recent studies that focus on the drivers and outcomes of pollution disparities in Louisiana, including the area conventionally known as Cancer Alley. Oops, let's go back one. With respect to the interpretation of cancer data, there are some important considerations that we like to keep in mind. One is that these data represented in the Louisiana Tumor Registry annual reports makes comparisons of an area. Oops, I think that was supposed to go back. All right, there it is. So basically, we in our Louisiana Tumor Registry annual reports, which is our state registry for cancer data, they make comparisons of an area called the Industrial Corridor or Cancer Alley, which is actually represented in that orange area on the map on the left. And they compare this area to the rest of the state. And these comparisons have been used extensively in decision making, so they really do have real world impacts. For example, to use a quote from the Louisiana Tumor Registry's 2019 annual report, they said that the industrial corridor rates for all cancers combined for white men, Black men, and Black women did not differ significantly from Louisiana's average. And when referencing this quote, the first thing that kind of jumps out at me is that the statewide rate is not really a gold standard. Louisiana actually has the second highest number of new cancer rates or new cancer cases in the US. So if we're saying that something is similar to the Louisiana average, this is not necessarily reassuring. Another point that's important to note is that we do know facilities that emit toxic air pollution exist in every region of our state. And in this map on the right, every little orange square actually represents a facility that reports to the EPA's toxic release inventory. So we can see that, yes, there's definitely a high density of these facilities in the area between Baton Rouge, Louisiana, and New Orleans, which is known as Cancer Alley. But there are also many of these facilities in other parts of the state. And these are heavily industrialized areas, but they're normally always lumped into that state average and left out of the conversation because they're not in that industrial corridor. So let's actually take a look at things on kind of a smaller parish or census tract level scale. So here we have a map of St. James Parish in Louisiana, which is an area in that industrial corridor or Cancer Alley, where a lot of questions and concerns about pollution-related health outcomes have received a lot of attention recently. And these data show here that these are the national percentiles of 2017 air toxics cancer risk, and it's the EJ index. And this is actually a value that factors in pollution, race, and poverty. So previous approaches in research and decision-making would often group areas like this into one cancer incidence value. But in this figure, we can see the variation in cancer risk from toxic air pollution that actually occurs when you're dealing with such demographically and industrially different census tracts within a singular parish or county, as some people call it. And it's important in research that we use a data set that more accurately reflects the local variation of neighborhoods in the parish or county and allows for greater statistical power by having a larger sample size for the studies. And kind of a huge milestone for Louisiana in the availability of this data was that in 2018, the Louisiana Tumor Registry actually released this census tract level cancer data. So, there it is. So this is actually a singular facility located in Lake Charles, Louisiana. It's called Sasol Chemicals. Now, hopefully this photo kind of puts into perspective not only the massive scale of these facilities and how the people facing the burden of pollution are right next door, but also that this type of industrialization exists outside of the industrial corridor or Cancer Alley. This is a common misconception that occurs throughout Louisiana, where you have these areas with heavy industrialization, some parts even more industrialized than the areas in the corridor, being left out of the conversation. So now that we've gone through a bit of background information, when Kim and I actually approached our study, we were aiming to answer two main questions. One are the firsthand experiences of Cancer Alley residents, which indicate that their communities are overburdened with cancer, reflected in Louisiana Tumor Registry data. And two, does toxic air pollution contribute to Louisiana's high cancer burden? So it's important to note that, although our job is to provide communities with relevant information and resources, we're not trying to prove or disprove any of these experiences from clients at the clinic, but instead we wanted to look at the data objectively to see what it said. So here we actually have kind of a graphic representation of our results. So as expected, we found that poverty significantly influenced or was significantly associated with census tract level cancer rates, and that parish was as well. But we found this interesting kind of interaction effect between air pollution and poverty on cancer rates, meaning that there's an effect of air pollution, but that effect is influenced by the poverty status of a neighborhood. And similarly, we found the same thing for race. So for the rest of the talk, we're going to be talking about poverty, but just know that our results were consistent whether we looked at race or poverty in our model. So here we have a table showing some of the important cancer incidence data from our study. And when we looked at the cancer rates for each of these data subsets, you can see that the impoverished areas with very high pollution and impoverished areas with very low pollution have higher cancer rates than their affluent counterparts. And when you break that down even further, the impoverished areas with very high pollution have higher rates than the impoverished areas with very low pollution, meaning that pollution is a significant driver in the cancer rates of the state. And for anyone who's interested in kind of looking at the statistics, we have some values on the right-hand side that kind of support the data. And now when we applied these cancer incidence values and estimated kind of a quantitative value for the disparity, we estimated that there are 850 extra cancer cases per decade that can be attributed to toxic air pollution among fence line communities in Louisiana. And again, oops, go back. And again, this is a very conservative estimate because it assumes that no one gets cancer from air pollution in mostly white or affluent neighborhoods. Oops, go back. And these results are all published in environmental research letters and available for anyone who's interested in taking a more in-depth look at the research or the data, and we encourage you to do so. And I'm going to actually pass it over to Kim to kind of expand on some of this research.
Thanks, Gianna. So I know a lot of folks in this group are interested in how science can be used for action. And this is one example of research that we feel like has been really helpful in concrete ways and in general ways for community members. So anytime you're trying to move the needle on public perceptions, it's a long game and it can be difficult to measure. And so sorry, I'm trying to advance. Okay. And so we really try to frame our research, as Gianna said, in terms of, scientific support for what communities already know, right? And this commentary was a great example of that framing, right? So the idea being that science is catching up to people's firsthand experience. But in addition to providing community members with scientific support for their own advocacy, this research has been helpful in more specific ways in our engagement with EPA and other agencies. So for example, our law clinic is currently representing several community groups on a Title VI complaint alleging that our state DEQ effectively discriminates against communities of color in its decision-making. And so having scientific studies to reference or that EPA can reference in that investigation is really helpful. And I think as scientists, we're sort of trained to do, the broadest research possible, right? National studies, global studies. But I really want to emphasize that sometimes local and state studies can be really powerful because, it's important to know at what geographic scale these disparities exist. So with that, I want to talk about a more recent study that we published that also aimed to provide support for EPA's Title VI investigation. And in that study, we focused on quantifying the pollution disparity in Louisiana and better understanding the drivers of that disparity. So we focused on 3 questions, and our study compared industrialized neighborhoods that were predominantly people of color to industrialized neighborhoods that were predominantly white. And when I say industrialized, I mean a census tract with at least one industrial facility that emits enough pollution that it's required to report to DEQ, our Department of Environmental Quality. So the map on the right illustrates it wasn't just Gianna, there's some wonkiness with the slide advancing. But the map on the right, each triangle illustrates a center point of a census tract, and the triangles that are yellow are disproportionately people of color, whereas the blue triangles are disproportionately white. So what you can see again is that we have industrial facilities across our state, both in white and communities of color. And so again, we wanted to, examine objectively whether there was a disparity in emissions and to quantify that potential disparity, but also to evaluate which industry subsectors contribute most to any emissions disparity. And thirdly, and perhaps most importantly, we wanted to examine the role of industrial infrastructure in any pollution disparity. And this was important because our state DEQ has been promoting a narrative that it's not discriminatory permitting. It's simply that the industrial facilities go where the infrastructure is, and those areas are disproportionately people of color. So there hasn't been any scientific evidence for or against that narrative previously. So that was an important part of this study. And so the first thing, again, we did was to quantify the emissions disparity. This table illustrates normalized emissions, but so it's for each of the 6 criteria pollutants, right? These are common industrial pollutants, and the values in the table are annual emissions per land area, per unit of land area. So we took all the census tracts in Louisiana, divided them into quartiles based on race. And you can clearly see, if you look at the top row versus the bottom row, communities that are disproportionately people of color have vastly higher emissions compared to mostly white communities. And again, this comparison excludes census tracts that don't have any industry at all. So we're comparing apples to apples. And so if we take the ratio of that top quartile or the top row to the bottom row, we can see that communities of color have between 7 and 21 times higher emissions of common industrial pollutants compared to mostly white neighborhoods. So again, we wanted to look at which industry subsectors contributed to this. So we took those 2 quartiles, right, the top and bottom quartiles, and we broke down emissions by industry subsectors. What we found was that consistently chemical manufacturing and petroleum manufacturing are the largest contributors both to emissions in Louisiana, but also to the disparity in emissions in communities of color. So again, nothing that's terribly shocking if you're somebody who lives here, but it is so important to have a study to point to in a place where this information is published. And then the third piece, which I think was, kind of the most interesting academically for us, was the role of infrastructure in this emissions disparity. So this is a map that Gianna put together, and it illustrates the locations of industrial plants in Louisiana, with each plant being a point relative to different types of infrastructure. So we have railways represented as black lines. Pipelines, oil and gas pipelines, are represented as the dashed gray lines. Ports are the little boats, and you have the lower Mississippi River outlined in blue. We did what's called a cluster analysis. So we grouped facilities into clusters based on their proximity to each other, and that's what the color-coded dots represent. So all the facilities that are the same color are in the same cluster together. And one thing that was really basic, but I think really important, is that this allowed us to objectively characterize the industrial corridor. So previous research sometimes includes a 7-parish region. We have parishes in Louisiana instead of counties. Sometimes it's an 11-parish region. People say it's a 90-mile area with 100 facilities or 200 facilities. There's like all different numbers that have been thrown out there. So in fact, based on our cluster analysis, the facilities in blue, yellow, and orange are what are kind of commonly known as the industrial corridor or Cancer Alley. This is a 184 river mile stretch with 378 industrial facilities, all the way from Point Coupé Parish to Plaquemine Parish. And beyond that, we can see that, yes, clearly, these facilities cluster around infrastructure. And if we zoom into the map and look at South Louisiana, this clustering is very apparent, right? Like these dots are not distributed randomly across the landscape. They tend to occur around the Mississippi River for its transportation resource, as well as around railways and pipelines. And if I go back to the last map, you can see that there's big areas in the center part of the state where you don't have industrial infrastructure and you don't have industrial facilities. So yes, the facilities are clustered around infrastructure, and if infrastructure is driving the emissions disparity, we would expect that census tracts that have these types of infrastructure would be disproportionately people of color. And so when we looked at the data simply did not support that. So the overall state average for Louisiana is 42% people of color. And in almost every case, or in the majority of cases, the demographics of census tracts with infrastructure were representative of the state overall, right? The one exception was railways, which were slightly disproportionately people of color in those areas, but certainly not enough of a difference to drive the stark disparity that we found in pollution burden. And so this study is published, came out earlier this year, and I'd encourage anyone who's interested to dig more into it, and feel free to reach out to us with questions. To wrap up, our research has really helped lend scientific support to what communities already know to be true, that they're overburdened with both toxic air pollution and cancer. And I really try to encourage communities to use statewide studies and even national studies, rather than pointing to the cancer rate in their town, because there could be many reasons why that rate is not statistically elevated. We also quantified the emissions disparity among communities in Louisiana, and most importantly, we found evidence that industrial infrastructure does not play a role in this disparity. And because we focused specifically on facilities that are permitted by DEQ and report emissions to DEQ, we are really confident that it's permitting above anything else that drives this disparity. So we'll be happy to answer any questions. And with that, I want to thank you all for listening.
Amazing. Thank you so much, Kim, and thank you, Gianna. For folks, if you want, you're welcome to raise your hand and I'll call on you if you've got any questions. I see one question in the chat from Dan, so I'll start from there. So Dan asks, have you done any analysis of new or proposed petrochemical facilities to see if they continue to exacerbate exacerbate the disparities? Sorry, did not cleanly do that.
Well, I'll jump in. We haven't, but I don't know of any facility that's been proposed in a predominantly white community. All of the facilities that we know that are currently in the works are in communities of color. So I think anecdotally, we really don't see any reason to expect that this trend is going to change, within the next couple of years.
Awesome, thank you. Tracy?
Yeah, thank you. That was really great. Super interesting. In terms of the permitting or the emissions to facilities and emissions and being higher in communities of color, is there something related to are the facilities larger in the communities of color, or are they just not have control? Like, did you look at that aspect of what's contributing to the larger amount of emissions?
So I think from looking at the industry subsectors, I think that part of what's going on is that there are more petrochemical facilities in communities of color, and petrochemical facilities tend to have higher emissions than other industry subsectors. So just, kind of semi-anecdotally from going through the data, a lot of industry in the rural parts of our state are like paper manufacturing, wood products manufacturing. So I think the type of industry definitely plays a role. And in terms of, are there differences within the same type of industry, but just based on scale? My gut says probably not. But certainly we could do, I think, a whole nother paper where we kind of dig into the drivers of those disparities more.
Right. I'm just wondering, like, in terms of an EPA like you're looking at a Title VI, and I think there's maybe you could talk a little bit about what EPA's current action is. I guess it's against DENCA, right?
Yeah.
But I'm just wondering because petrochemical facilities might be regulated in a different way that for certain like power plants. So it's just interesting component of the potential interventions that could be considered for this, right? They're addressed under different parts of the Clean Air Act.
Yeah, definitely. And just to clarify, it's a little confusing because there are actually two Title VI complaints in Louisiana that are being investigated in parallel that were filed around the same time. So there's one complaint that was filed by Earth Justice that focuses on DENCA specifically. And then there's another complaint that was filed by our clinic that focuses on the state's system of permitting. And so that second piece, the state level permitting is where we've been paying the most attention and sort of thinking about how our research might inform that. But I definitely hear your point. And, if we're thinking about things in terms of EPA rulemaking, then industry subsectors become really important.
Right.
So yeah, that's a great point.
Well, I was just thinking about like, do they not have the same emissions controls, or they're bigger facilities? But it sounds like because it's a subsector that allows differences in how they're addressed. But I thought that EPA also had filed some.
EPA has like an enforcement action against the DENCA facility, I think, or is DENCA and Formosa the same? Yes. Yeah, you're nodding. Great.
Or Formosa, right?
Yeah, no, you're correct. It's DENCA that the enforcement action is focused on. And I will say, just this sort of just popped into my head. I do know, like, I can think of an example of a predominantly white neighborhood in St. James that has a very small scale grain facility versus several communities of color that I know of that have like much larger scale facilities, grain terminals, I should say. So yeah, I think there's a lot of complexity underneath those subsector differences. But yeah, again, a great question.
Right.
Awesome.
And is your complaint going to be heard at the state level with your state Supreme Court, or is that a federal action?
So the Title VI complaint is a petition to EPA. So it's not actually a lawsuit. It's a complaint in the sense of a petition. And so it gets decided by EPA, and the idea, like the stick that they have to try to encourage the state to cooperate, is the potential to withdraw federal funding from the state program. So the idea is that in an ideal world, the state DEQ sits down with EPA and works out an agreement to address the issues identified in the Title VI complaint. If that doesn't happen, if the state says, we are not going to agree to these terms, then EPA issues findings. And so they can ultimately find that, yes, the state has discriminated, or no, it hasn't. What's really exciting from our perspective is that, the current EPA is taking a much more active and aggressive approach to investigating Title VI complaints than what we've seen previously.
Awesome. Thank you, Kim. Does anybody else have any questions? If you want, you can raise your hand or put the questions in the chat. Or unmute yourself, I guess, if you are not sure how to raise your hand. Kristen? Oh, Christopher. Great. Go ahead, Chris.
Hi, I was just wondering, my name's Chris, I'm a PhD student at UC Berkeley. And I sit next to this guy, Eric, who works for the California Cancer Center in, or like the cancer, I don't even know what it's called. But something he keeps saying in a lot of our different classes is that it's really hard to prove cancer clusters, or not prove, but like draw causal inference around different cancer clusters. And so I was just wondering, based on your work here in the first article that you shared, if you have any advice for those working in other states, or just trying to look at a similar relationship between like the air pollution rates in different parts of states and cancer rates, and to draw like causal claims from that.
Yeah, I'll jump in, and Gianna, feel free to jump in also. I don't want to dominate. The analogy that I like to use with folks is it's a lot like lung cancer and cigarettes, right? So sure, if a person has lung cancer, even if they smoke, you can't say with 100% certainty that the lung cancer came from smoking, but you can talk about risk, right? And you can say that, well, because you were exposed to this thing, you were much, much, much more likely to have developed cancer. So, you know, on an individual basis or even on a neighborhood basis, it's hard to make those connections. But studies like ours, we could say, okay, well, you know, what our study shows is that Louisiana has more cancer cases than what you would expect based on non-pollution risk factors. And we've, you know, definitively attributed a certain number or percentage of cancer cases across the state to air pollution exposure. So I guess my biggest suggestion would be to always kind of come back to risk, because you can definitively, you know, or at least quantitatively attribute risk to different factors. Whereas if we're talking about health outcomes, you know, it's a lot more complicated. But I know there's also a lot of other environmental health scientists in this group who probably have strong opinions on that point as well. So if anyone else wants to jump in, please feel free.
Okay. Hearing no
Thanks,
jump.
I appreciate the explanation.
Oh, go ahead, Chris.
I was just saying.
Cool. Well, hearing no further questions, I guess we'll move on. Kim and Gianna, maybe if you could share your emails in the chat if folks have follow-up questions for you. And then otherwise we'll move into our updates section. But thank you so much. The presentation was so excellent. Thank you also for all of your work. So appreciate you.